viewers with whom we are discussing the situation in COVID right now, and if a third dose, a booster dose, is the only way to defeat COVID. Dr. Shamsher Dwivedee, on that specific question, because WHO has taken a position different from US, UK and Israel, is it fair to say that whether to take a booster dose or not, the simple answer is on how many vaccines you have available, on that decision rests?
No, yes, to a great extent, say you have to strategize your fight with COVID, and every country has a different demography and a different reality which they have to face. With the available supply of vaccine, the first priority for India should be to vaccinate each and every individual, and only then we should think of booster. In between, if suppose situation arises that we suddenly find that there is a spike in those states where earlier there was a lull, in that scenario you can re-strategize and start immunizing the elderly, the immunocompromised, the health workers, the police, those who are in public services. But at this point of time, with the available data and of the disease spread, I think our first priority should be to first immunize each and every individual. And one more thing, Arunima, I would like to emphasize that even if we immunize 100% population in a state, if social distancing and other norms are not followed, then in spite of vaccination, the disease would spread. Vaccination doesn't stop the spread of the disease. Even if they do 100% vaccination, if the social norms don't change, then it is bound to spread, and then only lockdown remains the only solution in that situation, which one would try to avoid.
Right. Dr. Mehra, I want to bring you in on that point, because, if the haves, if the countries like US, UK, Israel, and the haves of this world, if they want to focus on getting the third dose of the vaccine, and we know how suddenly there, all public places have been opened, people are going out to the bars, they're going out to the malls, vacations are being now spent outside. So social distancing, COVID appropriate behavior may not be so much of a priority after you take that. So if this is how the developed nations are going to behave, will we ever win this fight against COVID worldwide? Because there could be some countries in Africa, some countries in Asia where not even the first dose is available.
Well, Arunima, I am absolutely sure that we're definitely going to win the war against COVID. There's no doubt about that. The question is, that this is the experiment done in Israel. Israeli population, the Israeli government has given the third dose, and they found that it is found to be very, very helpful. Now, whether this has to be immediately adopted by every other nation or so, that is a debatable point. Even the US has said that we want to give the third dose to be given to a very select group of maybe 70 plus healthcare workers, those undergoing kidney transplant or any other organ transplant, those people who are diabetic or cancer, or those who have less immunity in them. And this is what we will also do. We will definitely do. We will also give the third dose, but maybe after we have covered our major population. So I said the 18 plus, and that should be our first singular goal, that we should by the end of the year finish vaccinating even with one dose. That is enough. Even with one dose, we should finish giving by the end of the year. So we are targeting about 180 to 190 crore jabs. So we have already given 67 crore. We have not done that badly. The number 2 point is that, even though some of the countries are now trying to give this third dose, we will wait and see and how it goes. Definitely, the immunity is known to last longer. There is no problem at all. And some people feel my antibody levels have gone down, my neutralizing antibody levels have gone down. No problem. There is always those memory T cells. The memory T cells remain for life. So once you have taken the vaccine, and if you've taken 2 doses, that's absolutely fine. If you've taken 1 dose today, you will definitely take it after 12 weeks, the second dose as well. So I think we are going on track. We should not deviate from our track. Rather, we should focus on getting more vaccines actually. And my understanding is by the end of this month, or maybe definitely by early next month, we will have 2 or 3 or 4 more vaccines in India. So I think we are definitely on track. We don't have to worry about it.
Professor Mavalankar, one of the reasons why a lot of people are worried, especially parents who have young adults or children at home, younger children at home, is because of the third wave. And this report which suggested that the third wave could hit in October, that it could possibly impact children, that has once again led to a lot of anxiety as to what all should be done. And this third dose, this booster dose, is also one of the things that came up from the discussion there. Can you just put it into context for us, the possibility of a third wave, the possibility of children being the target, and how the vaccination, the possibility of a booster dose fits into that larger picture?
Yeah. So as an epidemiologist, what I see, and we have the ICMR zero surveillance. Of course, the number is small, 30,000 sample for the whole country is small, but 67% are already having antibodies, I said. Ahmedabad City Municipal Corporation did a survey some time back. 82% of Ahmedabad 5,000 sample had zero antibodies in the blood. So my sense is large parts of the country where there are very few cases being reported, already there is a lot of immunity because of infection as well as ongoing vaccination. So I don't see a major possibility, but we have to continue to monitor the situation with a hawk's eye to see where new cases, new clusters are developing, and whether immune evasive variants are emerging, especially from where large cases like Kerala, where 30,000 cases are happening, and whether they will spread. So that is the worry. Second is children's immunization. We must take it up on a war footing, because schools are opening, children are still not immunized, even though ICMR survey showed 55% children between 9 and 18 were having antibodies. So the other side of the puzzle is we must do large-scale zero surveillance, and there are ways to do it. Even voluntary blood donors, pregnant women can be tested on regular basis to find out how many are immune. Because if the virus circulation is very less, even if immunity is less, it will not lead to large pandemic.
Right.
For example, in Gujarat, there are only 15 or 18 or 20 cases happening each day with 6.5 crore population.
Yes.
So total virus circulation doesn't seem to be there. We are doing about 50,000 tests every day.
Right.
So there are large parts of the country, I don't think. But what is happening in Kerala has to be deeply studied.
Absolutely.
Is it just because of lack of immunity, or something else is also the reason?
Right. Sir, thank you so much for your time. I know, sir, Dr. Nair wants a final word. I'm running out of time, sir. In 30 seconds, if you could just sum up what you want to say.
Just one last point. Although we are doing very well in terms of the vaccinations and also in terms of the immunity that has been talked about, but I want to caution that even though there is some element of herd immunity developing in certain parts of India, the caution here is the COVID-appropriate behavior.
Right.
We are entering into the festival season, and the next 2 months are going to be festival months. My request with folded hands to everybody is to, at least for the next 6 months, please follow the COVID-19 appropriate behavior.
All right. What is the consensus? Rather than worry about a booster dose, about a third dose, first and foremost, ensure that you get the first dose of COVID vaccine. If you get 2 doses, nothing like it. Second thing, focus on COVID appropriate behavior. It's the festival season. Whether you've got the vaccine or whether you've not got it, ensure that you mask up, that you maintain social distancing and not crowd around in this festival season. And third thing, think about vaccinating children, young adults. That process should go on a war footing, as all the doctors on my panel said. I want to thank Dr. Shamsher Dwivedee, Dr. Narinder Mehra and Professor Dileep Mavalankar for their time, for putting into perspective this debate on whether we need a booster dose, whether we need a third shot of vaccine to keep ourselves safe from COVID. That full show is also up on our website, news18.com, if you want to listen to the panelists once more. Thanks for watching. News and updates continue on the other side with Mahasiddhi.